Hello, my name is Dr. Anthony Inglese. I'm a chiropractic neurologist as well as the clinical director for the Brooks Clinic. I would like to thank the Oklahoma Association for Justice for allowing us to provide you with these educational topics each month so that hopefully these can help strengthen your ability to properly represent your clients' cases in regards to their head and spinal traumas. So our topic this month is disc protrusion and what does it mean? So a disc protrusion by definition, disc protrusions are only appropriate in describing a disc herniation. And then if the greatest plane in any direction between the edges of the disc material beyond the disc space is less than the distance between the edges of the base when measured in the same plane. That's per Fardone and Millette in 2001. They came up with the disc nomenclature. So that is just a very difficult way of stating. As you can see in this picture, the yellow is the vertebral body, the blue is the intervertebral disc. This is the disc lesion, which is going beyond the normal margins of the disc. This, where the disc begins to emanate from the normal body of the disc, is what's called the base, and the furthest point away would be called the apex. So as you can see in this picture, the base is wider than the apex. Therefore, by definition, this is a disc protrusion type herniation. If this was different than this and the apex was wider, almost like a mushroom, that would be called a disc extrusion. But in this case, the base of this disc herniation is wider than the apex of it. Therefore, this is a disc protrusion. So disc protrusions may be focal or broad-based, and the distinction between focal and broad-based is arbitrarily set at 25% of the disc circumference of the disc. Protrusions with a base less than 25% or 90 degrees, since a full circle around would be 360 degrees, of the circumference of the disc is called focal, and protrusions with a base that encompasses 25% to 50% of the circumference of the disc is considered a broad-based protrusion. Again, that's per Fardone and Millette. So as you can see, you have the disc here. The dotted line around it is the disc margin. The solid line is the vertebral body margin. As you can see here, and the gray area is disc material. So as you can see here, this is dissected into quarters, and this disc material has gone out in this region, and it's within 25%. So this would be called a focal disc protrusion. If this disc protrusion extended to almost and just under 50%, this would be called a broad-based disc protrusion. And as we'll talk about in later lectures, if the disc material extends beyond 50% of the total circumference of the disc, that would essentially be called a disc bulge. So regarding disc nomenclature, there are many types of terms that describe morphology or what the picture looks like, and those terms that are included in the radiologist's report. When we talk about etiology or the cause of the disc pathology, there are only two categories, degenerative and traumatic. Degenerative is slow pathology. Disc bulge would be characteristic of that, which is degenerative. And then there's traumatic, instant pathology. Disc herniation represents a traumatic type injury. Protrusions, extrusions are types of disc herniation. And then all other morphological terms fall under these two categories. So why is it important knowing disc nomenclature in your trauma cases? Knowing if a disc is bulged or herniated may help determine if a disc lesion is traumatic versus degenerative. This would have to be clinically correlated by the treating healthcare provider through a comprehensive history and physical examination. And knowing disc nomenclature will help you understand the terminology that radiologists use on MRI reports to better understand your client's condition. I hope that explained disc protrusion to you, as well as describe how you come up the differences between a focal disc protrusion and a broad-based disc protrusion compared to a disc bulge. Remember, the protrusion is a type of disc herniation that's traumatic in nature, whereby a disc bulge is more degenerative. If you have any questions in regards to this topic or any of our previous topics, Our number at the office is 405-943-0303, or my email is listed here. You can email me at any time in regards to any question you may have, and you can look at our services that we have to offer at the clinic at thebrooksclinic.com. Thank you, and we'll see you next month on the next topic.